Ladies and gentlemen, good afternoon, and thank you so much for being here today. My husband George and I started Seleni in 2011 because we envision a world where every woman, every mother, has access to exactly the care she needs as she navigates building and raising a family. Now, motherhood may be part of nature, but that does not mean it is easy. Women are expected to master their professional and personal lives while suffering from depression at 2 times the rate of men. They earn less, yet work more, while bearing the significant physical and emotional burdens of starting and raising a family. Mothers too often don't seek help for fear of being shunned. Thus, millions suffer in silence. So Seleni exists to provide support for women by providing care, online information, research funding, and professional trainings in reproductive and maternal emotional health worldwide. This could be the sole purpose of our mission, providing support to mothers and families. There's certainly enough work to do, even right here in New York City. It's necessary work, it's gratifying work, and it's an incredible privilege. But we realized we were missing something deeper. Seleni exists to shine light into the dark shadows, because at Seleni we're comfortable sitting in uncomfortable places. Places like grief and guilt, loneliness and sadness. We don't bring quick answers or pat solutions. We sit with those in suffering and bring support and help and hope. So important. But then what? Yes, we bring people back from the brink, but it's not over. Do they not still have to confront the same set of challenges that so many other women face? Many of the women here today have faced these challenges. Now, more than 19 million families with children in the United States have a mother who is the primary or co-breadwinner, and 70% of children live in households where all adults are employed. Sweden has 480 days of paid parental leave, of which 90 days are reserved for fathers. Canada has 17 weeks of paid maternity leave, after which both parents can share the remaining 37 weeks. How many days might you think American families have? 0. The result? Bad policies lead to bad outcomes. As paid leave decreases, infant mortality rates rise, and children are slower to reach developmental milestones. Poor paid leave policies are also linked to higher rates of depression in women. The children of mums with depression are 12 times more likely to suffer from a learning disability and are more prone to depression, anxiety, and violence themselves. But even if a mother knows about the harms of little to no leave, the decision is too often moot. Let me explain. At Seleni, we've extended our services free of charge to pregnant and parenting teenagers as young as 14. Monica is the perfect example of one of our young mums who is constantly struggling to succeed, despite the odds. Monica's 19 years old and has a 3-month-old daughter, Yuri, that she's raising all on her own. Apart from dealing with her feelings of shame that are constantly reinforced from the pediatrician to her very own mother, she worries about so many things, from child-rearing to managing tenuous relationships with her family and others, to fighting for public assistance for herself and her daughter. But her biggest worry of all is keeping her job so she can keep her life afloat. You see, Monica earns minimum wage, working part-time in a retail store, with a schedule that changes daily. She spends every moment worried about which reluctant family member or friend can watch Siri. And she panics about how she will drop off her baby across New York City, some days as early as 4 a.m. in order to get to her job by 6. So from childcare to work and back home again, she rides the subway for hours every day. And this has been happening since baby Yuri was 9 days old. Monica dreams of a high school diploma, a full-time job, and of course, a better future for Zuri. But right now, she can barely see a path to tomorrow, let alone their lifetime ahead. Monica and Zuri are not asking for much, but they deserve so much better. And so here we come to that uncomfortable place I told you about earlier, that Seleni often takes us to. A society that makes it virtually impossible to support a young child and work at the same time, or to choose not to have a child at all. That society is showing by its actions that it does not value parenthood. Here's the conflict. We imagine the ideal mother as one who is singularly devoted to her family, and the ideal worker, singularly devoted to her employer. So when we expect singular dedication in both circumstances, women by definition are unable to do both. As long as we overlook this either-or proposition, as long as we pretend we have choices, we're stuck at the crossroads. And unless we recognize that it is both an ethical and an economic dilemma, we will remain stuck at that crossroad. We need to create a new reality for parents in the workplace, regardless of their financial status.